Ed Lopez is a 42-year-old man who presented to his doctor about 2 weeks ago with a chief complaint of a sore throat and fatigue. The sore throat proved to be viral pharyngitis. The fatigue had been going on for 2 months. After obtaining further history and performing a physical exam, his doctor did a random blood glucose in the office. The result was 210 milligrams deciliters, which was highly suspicious for type 2 diabetes. To confirm the diagnosis of diabetes, Mr. Lopez's physician ordered a follow-up random blood glucose. Mr. Lopez is back in the office today to review the result.
Hi, Mr. Lopez. So if I remember, we're going to discuss some lab results today.
Right, that's correct.
You'd come to see me a couple weeks ago and you were feeling really tired.
Yes.
And we had gotten that one blood sugar in the office that was a little high, and so we were concerned about the possibility of diabetes. Well, I have your labs right here, and it looks like you do have diabetes. So I'd like to go ahead and ask you a few more questions.
Sure.
Okay. So the first question is, you had said you're tired. Is that throughout your body? Is it only in one part of your body? Could you explain that a little bit more?
I feel tired physically all over and mentally sometimes too. Sometimes I feel like my brain is just fuzzy-like.
And are you having any chest pain at all?
No chest pains.
And just write that down. Okay. How about any pain in your feet at all?
No, I get blisters sometimes, but that's about it.
Okay. And any visual problems?
No, none.
Okay. And going to the bathroom? Any change in the amount of times?
Well, yeah, now that you mention it, I seem to be getting up often at night to go pee, probably more so in the last couple of months.
Okay, and about how many times would you say?
I'd say about 3-4 times.
Okay.
But you know what? Even in the daytime, I seem to be peeing quite often.
So is there any time of day that you feel it's worse or better?
My brain feels more mush towards the end of the day, but physically I'm tired all the time.
Okay. And how does that affect your day-to-day life?
I go to work every day, if that's what you mean. And when I get home, I guess I should be doing more around the house, but gosh, when I get home, I just feel like I want to go to sleep.
And this whole thing's been going on for about, since you came to saw me, I think you had said about 2 months, correct?
Yeah, it's been about 2 months. Now that you mentioned the getting up and urinating at night, it's probably been for about the last 4 months.
Does anything make it better or make it worse?
Not really. Even when I get a good night's sleep, I still get up feeling tired.
Okay. Well, the symptoms you're describing with the urination is definitely related to the diabetes. So we need to control the blood sugar. So I'm going to give you several things here. I'm going to give you a prescription for a drug called metformin. And this drug is a once-a-day drug, okay? So I'd like you to take it. It's really important to lower your blood sugar.
Okay.
And then I have here a referral to a diabetes educator, okay? And I think we have one more here. One is for a glucometer. And I'm also going to write you a prescription for that glucometer and for some test scripts. There you go. Oh, and one last thing is some lab work.
Sounds good. My brother's a diabetic as well, so he can help me with the glucometer.
Oh, okay. All right, well, I'll see you in 2 weeks then. Hi, Mr. Lopez.
Hi, doctor.
How you doing?
Okay, I guess. You tell me.
All right, let's look at your lab work here. Okay, your heme A1C was 9.5 and your cholesterol is 240.
Is that bad?
Well, I'd like to see both of those numbers a lot lower. Are you having any problems taking the medicine?
Well, I haven't been taking it.
Why not? Don't you realize that it's really important to get this blood sugar under control? How about the referrals?
Well, I haven't been doing that either.
Okay. Well, let's try this again. I'm going to go ahead and examine you. At the end, I'm going to give you you have the script. Please fill that. It's really important. I'm going to give you the referrals again, but we'll do the exam right now. And okay? Okay. You know, Paula, I don't get it. It's like he didn't do anything I asked him to do. I mean, why wouldn't he want to take care of his diabetes?
Well, did you ask him?
Here's a different approach to the same situation. The beliefs model uses questions other than the standard medical Sacred Seven to help gain an understanding of how the patient perceives these diseases.
So, Mr. Lopez, if I remember correctly, we're here today to talk about your lab results. Last time you came in, if I remember, you were feeling really tired and we had gotten that finger stick in the office that was a little high.
Right.
Well, I do have the blood sugar back today, and it does look like you have diabetes. So, if it's okay with you, I want to ask you a few more questions about that.
Okay.
The first question is, what do you think caused the diabetes?
Well, it's a family thing, genetics, you know, and everyone in my family gets it. So you can't do much about diabetes when it's genetic.
And how do you feel that it affects you?
Well, I know it's bad for your kidneys and your eyes, and I've heard it has something to do with high blood sugar, but I've also heard that low blood sugar is bad too, so I'm kind of confused about it all.
Why do you think it happened to you now?
Well, it's in my family. Most family members about middle age, they come down with it.
Help me understand your thinking process here.
What do you mean?
Well, I guess from my perspective, I feel that there's actually a lot we can do for diabetes, but I'm getting a little sense from what you've told me so far, but probably based on your experience with your family, that you just feel that there's not a whole lot that can be done.
Well, look, Doc, my grandparents, they both died from most likely diabetes. My mom has eye problems. My brother, he's got diabetes as well and doesn't take care of himself, and now he's on dialysis. And sooner or later, we're going to get it. I'm just hoping to be down the road somewhat.
So how does this affect your life now, and how do you feel it will affect your life in the future?
Well, it stinks. Part of me says I just go out and enjoy life best as I can, and the other part doesn't look forward to those kinds of daily needle pricks.
This must be very difficult for you. How are you feeling about it?
I've had better days.
Well, what you've said is absolutely correct. I mean, it is a genetic disease, but and I can certainly understand how the experience with your family members, particularly probably your brother, has made you feel like there's not much that can be done. But actually, in the last 5 years, we've made a huge amount of breakthroughs in diabetes, and we understand the disease a lot better. And we know that if someone exercises and takes medicines to keep the blood sugar low, you don't get the complications. So I'm very interested in working with you together on this to keep the blood sugars low and prevent the complications.
Here's one last approach, the ethnic model. This model goes beyond the history. It also incorporates negotiation and planning with the patient.
So, Mr. Lopez, if I remember correctly, we're here today to talk about your lab results. Last time you came in, if I remember, you were feeling really tired and we had gotten that finger stick in the office that was a little high.
Right.
Well, I do have the blood sugar back today, and it does look like you have diabetes. So, if it's okay with you, I want to ask you a few more questions about that.
Okay.
The first question is, what do you think caused the diabetes?
Well, it's a family thing, genetics, you know, and everyone in my family gets it. So you can't do much about diabetes when it's genetic.
And how do you feel that it affects you?
Well, I know it's bad for your kidneys and your eyes, and I've heard it has something to do with high blood sugar, but I've also heard that low blood sugar is bad too, so I'm kind of confused about it all.
Okay, what treatments have you tried, if any?
Well, since I saw you last, I've been trying to cut back on my sugar intake, and other than that, that's about it.
Have you sought any advice from, for example, folk healers?
Well, now that you mention it, I mentioned